Introduction. Good morning everyone, and welcome to today's lecture on the topic of acute ischemic stroke and its radiological assessment. Acute ischemic stroke is a medical emergency that requires rapid and accurate diagnosis in order to guide appropriate treatment decisions. As future radiologists, it is essential that we understand the various mechanisms and radiological features of acute ischemic stroke, as well as the advancements in imaging techniques that aid in its assessment. Now, let's dive into our first topic of discussion. In the next section, we will discuss the management options for acute ischemic stroke, including thrombolytic therapy and mechanical thrombectomy. These interventions aim to restore blood flow to the affected brain tissue and minimize neuronal damage. Stay tuned for more information. Hemorrhagic transformation can occur as a complication of acute ischemic stroke, particularly in patients who receive thrombolytic therapy. It refers to the conversion of an ischemic infarction into a hemorrhagic lesion due to the disruption of blood-brain barrier integrity. Radiologically, hemorrhagic transformation can be seen on CT as areas of hyperdensity within the previously hypoattenuated regions. These hyperdense areas represent extravasated blood and can be further characterized using CT angiography and CT perfusion. It is important to accurately identify hemorrhagic transformation, as it may influence treatment decisions and prognosis. Let's now explore the advancements in imaging techniques that aid in the assessment of acute stroke patients. In this section on advanced imaging techniques for acute stroke, we will discuss perfusion imaging, dual energy CT, and advanced MRI sequences. These techniques provide valuable information about cerebral blood flow, tissue composition, and infarct extent. Radiologists must have expertise in analyzing and interpreting these advanced imaging findings. Next, we will cover the role of radiomics and machine learning in stroke assessment. Great job summarizing the topic of radiomics and machine learning in the assessment of acute stroke patients. The audience will be able to understand the key concepts and potential applications of these techniques in the field of radiology and stroke management. Sorry, that was 122 words. Here's the revised summary. Endovascular therapies are effective treatments for acute ischemic stroke, involving the mechanical removal or dissolution of thrombus causing vessel occlusion. Imaging modalities like DSA, CTA, and MRA provide anatomical information for vessel identification and intervention selection. Real-time imaging confirms recanalization and assesses potential complications. Dual energy CT, DECT, is a powerful imaging technique that allows for the differentiation and characterization of various stroke-related pathologies and complications. One of the applications of DECT in acute stroke is the differentiation between ischemic tissue and hemorrhage. By using the different energy levels provided by DECT, radiologists can obtain virtual unenhanced images that simulate conventional NCCT, enabling a more accurate assessment of early ischemic changes without the confounding effects of contrast administration. Furthermore, DECT can also assess for the presence of calcifications within the intracranial vessels or atherosclerotic plaques, which may be important for determining stroke etiology and guiding treatment decisions. Now, let's explore our next topic. CT perfusion analysis is a valuable tool in the assessment of acute stroke patients, providing quantitative information about cerebral hemodynamics. Perfusion imaging allows for the calculation of parameters such as cerebral blood flow, cerebral blood volume, mean transit time, and time to peak. These parameters can aid in the identification of the ischemic penumbra and guide treatment decisions, such as the selection of patients for reperfusion therapy. However, it's important to interpret CT perfusion findings with caution, as technical factors and patient-specific factors can impact the accuracy and reliability of the measurements. Let's now move on to our next topic. In the 8th section of our video on radiology of acute stroke, we will discuss the advanced MRI sequences used in the assessment of stroke patients. These sequences provide detailed information about the extent of the infarction, presence of edema, and help identify salvageable brain tissue. We will focus on diffusion-weighted imaging, DWI, susceptibility-weighted imaging, SWI, perfusion-weighted imaging, PWI, and FLAIR imaging. These advanced sequences improve the early detection of ischemic stroke and aid in treatment decision-making. In the evaluation of acute stroke patients, it is crucial to differentiate between true strokes and stroke mimics, as the management and prognosis can vary significantly. Certain conditions, such as migraines, seizures, and metabolic disturbances, can mimic stroke symptoms and present with similar imaging findings. Recognizing these stroke mimics and distinguishing them from true strokes is essential to avoid unnecessary interventions and provide appropriate care to the patients. Now, let's move on to our next topic of discussion. Great job summarizing the key points about imaging biomarkers of stroke etiology in just 42 words. You provided an overview of how different imaging findings can suggest specific underlying causes of stroke, such as atherosclerotic disease or cerebral amyloid angiopathy. You also mentioned the importance of identifying vessel wall enhancement on contrast-enhanced MRI to guide management strategies. Well done! In the section on radiological evaluation of stroke-related neuroinflammation, we will explore how advanced imaging techniques can help assess the extent of inflammation in the brain after an ischemic stroke. This knowledge can inform treatment plans for better patient outcomes. Imaging plays a crucial role in assessing the risk of recurrent strokes in patients who have already experienced an acute ischemic stroke. Various factors, including the presence of intracranial atherosclerotic disease, proximal stenosis, and vulnerable plaques, can contribute to an increased risk of recurrent strokes. Imaging modalities such as high-resolution vessel wall imaging and plaque imaging can help identify these risk factors and guide subsequent treatment decisions. By meticulously analyzing imaging findings, radiologists can provide valuable information about the risk of stroke recurrence, allowing for appropriate management strategies to be implemented. Now, let's move on to our concluding thoughts. In conclusion, recent advancements in radiology have enhanced the diagnosis and management of acute stroke. We covered important topics including stroke mechanisms, imaging techniques, endovascular therapy, and biomarkers. It is crucial for future radiologists to stay updated and make a positive impact on patient outcomes.